Dave has agreed to save his question for the open session, so you'll get his question. He'll be first in line. So why don't we move on to the next model, controlled access to pooled or multiple data sources. And this is Jessica Scott, and then from GSK, and then Lori Ryan from the Alzheimer's Disease Neuroimaging Initiative. And thanks to Ira and to Joe for the terrific presentation there.
Okay, I'm going to just stay here because I have one slide, makes it easy. I'm not going to be turning too much. Just a quick overview, and then I'm going to get right into what we see as the benefits, challenges, and risks. This is a screenshot from the multi-sponsor access site that was launched January 1st of this year. And if you scroll, you would see five sponsors on there now. The space for additional sponsors could be an academic sponsor or industry sponsor. So to think of our approach as kind of 3 tiers, I think is very helpful. The first being this request site, which provides a whole lot of information about the individual sponsors and also the common framework for sharing, and one site for a requester, an external requester, to request data from multiple different sponsors, which can then be combined for meta-analysis or pooled. So that's the first level, the request site. The second level is the review panel, and at this time all sponsors are sharing the independent review panel that originally was part of the GSK single sponsor controlled access system. We are actively talking about moving toward a fully independent reviewing entity, and that is a high priority for all the sponsors. The third tier is the independent data custodian, which provides access to data through a secured password protected entry into an access site that allows for analysis of data on that site, and the analysis can be downloaded, the data cannot. So with this multi-sponsor system, we feel that the principles for data sharing that we believe and also are very much aligned with the study committee on are very much supported. We feel that de-identifying and anonymizing data is not sufficient for protecting patient privacy and confidentiality, and that the system, the controlled access system, actually provides layers of protection that do provide for that privacy protection, and also maximize the benefits of data sharing while minimizing the risks, including rogue science. We don't feel it's an all or nothing proposition, but that there are actually steps that can be taken via a controlled access system to mitigate the risk of rogue science by, for instance, requiring a statistician on the research panel. I agree with the comment earlier about there isn't a clear demarcation between some of these models. Even the open access models may require IRB approval or exemption, may require institutional affiliation, even though they are considered open access. But that does also represent some restriction on the external researcher from just a purely open from our perspective. And then also with regard to increasing public trust, we feel that achieving a review process that is independent from the data sponsor is really essential for increasing public trust. So with regard to the benefits, we feel that a multi-sponsor access system does ease the process of requesting data by researchers and facilitates increased access to multiple data sponsors with one proposal and ease of use of the system. We feel that the multi-sponsor site gives independence from any one sponsor of data. which enhances trust further, and a greater opportunity to facilitate some common and more unified approaches, for example, to data formats and anonymization. Also, increase of efficiency and lowering the bar to further sponsors joining an existing approach may enhance those who are contemplating or having a hurdle expense in creating their own system. And economies of scale is another benefit, where we're not looking at a single partnership in order to grant access, but we're making large clinical trials available and can continue to do that and have efficiencies of use of the common request site and an external panel. With regard to challenges, costs can be prohibitive, especially for smaller pharmaceutical companies, academic sponsors. And looking at that issue and trying to decrease cost is also a priority. The main cost being the common data platform, the independent data custodian. And we are pursuing how we can decrease costs with regard to that. Sponsors may have differences in their policies or the data that they may want to share, whether they want to be retroactive in their sharing. And this framework can accommodate some of those differences, and then in some areas may need some common approaches as well. I see that I'm running short on my time here.
You'll have a chance to add points in the discussion, I'm sure.
Yes, thank you. I think that covers the majority.
Okay, great.